gentleman from the Cape and the Islands, Mr. Cyr.
Thank you, Madam President, and through you to the members. I'm honored to speak about the legislation that we are taking up today to begin to reform mental health in the Commonwealth, the Mental Health ABC Act. I want to begin by thanking you, Madam President, for your leadership and for your example. When we share our stories, we make this work personal, and we arrive at better policy because of it. I am so grateful for your vision, and I also thank you for your belief in me. I'd also like to thank the Senator from Westport for the collaborative spirit that he brings to everything he does, including this legislation, and the Senator from Arlington for her partnership and dogged persistence in righting the many wrongs that people seeking mental health care have faced in the Commonwealth. A number of colleagues have contributed to this issue and to our thinking on this bill, including many members of the Joint Committee on Mental Health, Substance Use, and Recovery, and I'm grateful for their help as well. I think it's important that I begin to explain the Mental Health ABC Act by following in the example that you, Madam President, have set in discussing mental health. I have struggled with anxiety and depression since adolescence. From an early age, people knew that I was different, especially in school. It led to a whole host of experiences that I was able to navigate through therapy. Therapy helped me manage my anxiety and has helped me do things that I never dreamed I could. Yet I still can't get health insurance to cover my outpatient mental health care. Now, I'm a pretty savvy consumer. If I can't navigate through the barriers to accessing care in this broken system, imagine how many other people in the Commonwealth can't get the mental health they need. This is particularly urgent for our vulnerable populations. LGBTQ people like me are 3 times more likely to experience mental health challenges. You see that play out across a host of other vulnerable populations. But we're Massachusetts, and we believe that mental health care is for everyone. Simply put, too many people in Massachusetts struggle to access the mental health services they desperately need and deserve. The reasons are many and intricate. Mental health care is treated differently than physical health. It is not often covered by insurance. It's difficult to access, it's expensive, and it's hard to talk about. When we sunk our teeth into these real barriers, we identified numerous problems within the existing delivery model for mental health care. Patients don't know where to go. There is no clear place to get started. They struggle to find a provider. If they are able to find a provider, they struggle to afford that provider, many of who do not take insurance. And when they find care, they often have to wait weeks for an appointment. Add to these logistical obstacles the very real barrier that those needing mental health care must navigate their own shame, social stigma, and sometimes outright fear of discrimination. You, Madam President, understand this and have said from the get-go of this session, have really issued a challenge to us that you would like to see nothing less than a transformative approach to how we think about, talk about, and provide care for our mental health issues. So in drafting the Mental Health ABC Act, we approach this task with the primary objective of improving access to quality mental health for patients and their families. There is no clear front door for mental health care. The services that follow intake are often fragmented at best. To say there is a mental health care system is a stretch. Navigating the fragmented services that do exist and accessing that care is a significant challenge for patients, for families, and for providers. There is so much work that is needed to fix this broken delivery model. But we have to be mindful not to do harm and to try to avoid unintended consequences. Indeed, it will truly take some time to develop an integrated system of mental health care, more than one bill in one session. But our constituents, our families, and indeed us senators cannot tap into mental health services, and so we must act. The Mental Health ABC Act treats mental health care as health care. First, we address this through parity and other insurance reforms. State and federal laws are already in place to treat mental health in the same way as physical health. Yet despite 2 decades since parity was adopted in the Commonwealth, and even 12 plus years of parity at the federal level, the gap between coverage for mental health services and medical surgical care persists. The Mental Health ABC Act makes explicit existing parity laws and gives the Commonwealth more tools to enforce parity. This includes more reporting to DOI, explicit transparency on the process of how mental health benefits are covered and the ability to impose penalties on insurance carriers for parity violations. The bill also provides protections for patients with acute mental health needs related to how insurance companies handle prior authorization for services and how they determine medical necessity for coverage. And you'll hear from my colleague from Arlington further on those aspects of the bill in a moment. We take several other steps to reform health insurance. Mental health and primary care providers are often reimbursed at different rates for the same service. The Mental Health ABC Act seeks to level the playing field for reimbursement to mental health providers by requiring an equitable rate floor for evaluation and management services that is consistent with primary care. We also take a look at how insurance benefits are structured. Most insurance companies have subcontracted mental health benefits to specialty utilization management companies for years with mixed results. The bill directs the Health Policy Commission, in consultation with the Department of Insurance, to study and provide updated data on the use of contracted mental health benefit managers by insurance carriers. These are often referred to as carve-outs, so that we have a better sense of their efficacy for future legislation. Workforce is another of the primary focuses of the Mental Health ABC Act. Massachusetts prides ourselves on being the national leader in healthcare, and yet patients still cannot access mental health care. Many providers practice independently and don't accept insurance, which makes getting care inconvenient and unaffordable. And while the trend in healthcare has been towards consolidation, creating larger and larger players, delivery of mental health care remains broken, with many sole practitioners practicing independently. Certainly, low reimbursement rates are a significant factor, but we have learned that there are other real reasons that providers don't accept insurance. We've addressed several of these in the Mental Health ABC Act. For the providers who are participating in insurance, we want to make sure that they keep taking insurance. One of the biggest frustrations expressed by mental health providers across all licensure types is the sheer administrative burdens and delays associated with the process of being credentialed by an insurance carrier. To address this problem, the bill requires all insurance carriers to use one standardized credentialing form. It also requires a stricter turnaround time for approval of a completed credentialing request. Providers will receive a response within 20 days of submitting the form. This is a common sense change that will enormously benefit patients, providers, and health systems, as it will speed up the time it takes for new hires to be approved for inclusion in an insurance network. We've heard from hospitals, healthcare systems, and provider groups about the difficulties in hiring newly trained mental health professionals or recruiting those needed specialties from out of state due to exceedingly long wait times for licenses to be processed. The Mental Health ABC Act moves the licensing board for social workers, psychologists, and allied mental health professionals from the Division of Professional Licensure, where they currently operate alongside licensing boards, including landscaping, architects, plumbers, accountants, to the Department of Public Health. This will leverage DPH's healthcare expertise to streamline the licensing process so that we treat these critically important healthcare professionals like any other. In addition, the bill would help patients access care by planting the seeds for a more robust mental health workforce, with a particular focus on mid-level providers. One of the most effective ways we can make a difference is to connect those with mental health needs to a human being with skills and training to provide them help. And we also believe that locations where people are receiving mental health care are crucial, and that we need more healthcare providers with mental health providers who are co-located within primary care. To that end, there are several specific initiatives contained in the Mental Health ABC bill. The bill authorizes a psychiatric nurse practitioner fellowship pilot program in community health centers to provide additional support and training in psychiatric NP nurse practitioners for those who agree to work in community settings with underserved population. The program is designed to encourage these professionals to continue working in a community setting co-located with primary care, a place where mental health providers are sorely needed. The bill creates an interim licensure program for licensed mental health counselors so that they can be reimbursed by insurance for their services. This will allow LMHCs to be eligible for state and federal grant and loan forgiveness programs, increasing the number of licensed providers able to see patients. The bill also authorizes a pilot program for the Department of Higher Education in consultation with the Department of Mental Health aimed at creating a workforce pipeline to encourage and support individuals from diverse backgrounds to work towards careers in mental health. With this initiative, we hope to send a message to young people that this is valued and important work. Beyond just an increase in the number of providers, the Mental Health ABC Act works to create a workforce that is reflective of the communities we need it to serve. To that end, the bill seeks to promote a culturally competent workforce. We know that mental health care is most effective when a patient and a provider are able to build a trusting relationship. Language barriers and lack of a cultural competency can be a barrier to effective treatment. We need a more diverse and multilingual workforce to meet the needs of all patients. For instance, approximately 90% of mental health clinicians today are non-Latino, white, and Caucasian. The bill calls for an academic study conducted by the Office of Health Equity to review the availability of culturally competent mental health care providers within networks of both public and private health care payers. The study will identify potential barriers to care for underserved cultural, ethnic, linguistic populations in the LGBTQ community. The bill further directs an interagency health equity team under the Office of Health Equity to improve access to and quality of culturally competent mental health services on an ongoing basis. The Mental Health ABC Act would also make some critical changes around how providers are allowed to bill for services and what insurers are required to cover. Specifically, the bill prohibits insurers from denying coverage for mental health services and primary care services solely because they were delivered on the same day in the same facility. This will remove a financial barrier to the integration of primary care and mental health, allowing providers to care for the whole person. The Mental Health ABC Act also prioritizes breaking down barriers to care. The bill requires emergency departments to have the capacity to evaluate and stabilize a person admitted with a mental health presentation at all times and to refer them to appropriate treatment or inpatient admission. And the bill further directs the Department of Public Health to issue regulations for an expedited process for individuals under 22 years old. The bill further requires commercial insurance carriers to cover community-based services for individuals experiencing a psychiatric emergency. Currently, these services are only paid for by Mass Health. The Mental Health ABC Act also authorizes the Department of Public Health, the Department of Mental Health, and the Department of Elementary and Secondary Education to collaborate on authorizing 3 pilots for telebehavioral health services in public high schools in the Commonwealth. The pilot is based on an existing model between a hospital and several school districts in Western Massachusetts that has proven successful on many levels. The pilot aims to ensure that young people receive critical services early on and decrease the need for more acute services in the future. It provides access to rural areas. We're meeting students where they are in school, which is particularly helpful for families for who after-school appointments can be a challenge. We're using the location of the school, but we're not sort of adding a mandate on the school as well. And the ultimate hope is that these pilots will be able to receive insurance reimbursement for these services. As someone who represents far-flung communities in the Commonwealth, we felt it was important to look at access to care in geographically isolated communities. The bill directs the Department of Mental Health to consider factors that may present a barrier to care, such as travel distance and access to transportation when contracting for services in geographically isolated and rural communities. And we also start on a path towards integrating mental health with primary care. A lot needs to happen to get us to true integration. Here's where we've started. To craft effective policy to work towards that goal, we need more information, beginning with an understanding of what services are truly mental health services, how much they are used, and what they cost. The bill directs the Center for Health Information and Analysis to define and collect data on the delivery of mental health services to establish a baseline of current spending. This is an initiative that SHIA is already embarking on and one we endorse wholeheartedly. The Mental Health ABC Act further directs the Health Policy Commission to begin tracking mental health expenditures as part of its annual cost trends hearing. This is a fundamental first step to future efforts to move towards greater investments in mental health care within the existing framework of healthcare cost containment statewide. While comprehensive, the Mental Health ABC Act is a first step at fixing a profoundly broken system. Passage of this bill would continue a series of recent policy changes and investments the Senate has advanced thanks to your leadership, Madam President, and I just want to remind my colleagues of those. This session, we reformed retroactive claims denials, or so-called clawbacks for behavioral health services in the FY20 budget. We created the Behavioral Health Outreach Access and Support Trust Fund with a $10 million appropriation in the FY20 budget. We appropriated record funding levels for mental health lines in the FY20 budget. And we reformed Ghost Network provider directories through Chapter 124 of the Acts of 2019. In developing the Mental Health ABC Act, we engage in a collaborative process with dozens of stakeholders across the mental health space. And I think all of us saw so many of those stakeholders and collaborators with us just an hour ago on the steps of the Grand Staircase. We have tremendous partnership in leaders in the administration, Secretary Mary Lou Sutters, the DMH Commissioner, Makula, HPC Director David Seltz, the CHIA Director Ray Campbell, the DPH Commissioner Burrell, and countless staff from their offices. I want to thank the Attorney General's office for her assistance. I'd like to thank my House co-chair of the Joint Committee on Mental Health, Substance Use, and Recovery, Representative Decker, who shares a deep commitment to these issues and has helped me think, has helped shape my thinking on this bill. We have heard from insurers and providers, groups advocating for patients and consumers, and more. Advocates and groups of all sizes have come in to meet with me, meet with my colleagues from Westport and Arlington, and that has made this bill all the much stronger. And as I close, I'd like to thank the staff who made this possible. We are only as good as our staff in this work, and they have driven so much of this bill. Liz Gantz, my legislative director, who is just phenomenal. Pat Johnson, my chief of staff. Catherine Thibodeau, legislative aide. Jeff Sories, district director. Colby Dillon, Martha Kwasnick, Tova Miller, Margaret Eichner, Dave Swanson, Deborah Brown, Liz Berman, all on the policy front have done so much to make this bill happen. And all the folks who have worked with us on the communications end as well, Sarah Blodgett, Antonio Caban, Christina Gaffney, Bentley Hope. And one of the most essential partners has been my colleague and my friend, the senator from Arlington, who, as I mentioned at the beginning, has been doggedly persistent on these issues. I expect you're going to hear from her shortly. So, Madam President, with this bill, the Massachusetts Senate is living up to your challenge and to the promise that we've made to begin to transform how the Commonwealth addresses mental health. So as I close, Madam President, I ask that when a vote is taken on the underlying bill, it is taken by a call of the yeas and nays, and I hope that the bill is adopted. Thank you, Madam President.
Good Senator from the Cape and the Islands, Mr. Cyr, moves that when a vote on this matter, it be taken by a call of the yeas and nays, sufficient numbers having arisen, a vote of the yeas and nays will be so called. Thank you. No, I'm going to have somebody else speak.